Hi, this is Jack Rychik. I'm a pediatric cardiologist at the Children's Hospital of Philadelphia. I carry a number of other titles. I am proud to say that I am the holder of the Robert and Dolores Harrington Chair in Pediatric Cardiology, with that chair focused on single ventricle research. I'm the Associate Chief of the Division of Pediatric Cardiology at the Children's Hospital of Philadelphia. I'm also the Medical Director of our Fetal Heart Program, which we founded back in 2001 here at CHOP, and also the Medical Director of our Single Ventricle Survivorship Program, which is now transitioned into something we call our Fontan Rehabilitation, Wellness, and Resilience Development Program. So I carry a number of different titles, lots of different hats, something that my mother is very, very proud of, and she should be. However, I will tell you something that I am most proud of and that I share with all of you who are listening to this short video. And that is a lifelong commitment and passion for the care of children born with birth defects of the heart. Something I've been doing for over 25 years. I am primarily, I would consider a clinician, but a clinical researcher and somebody who has not just cared for children with congenital heart disease, helped families make their way through challenging and difficult times and difficult diagnoses, held the hands of both patients and families as they travel the course of congenital heart care, but also am very proud to say that I've had the opportunity to ask questions and to explore answers to unique questions that I know have then directly fed back to how I care for patients for congenital heart disease. I don't think there are many other fields of medicine like this where you can one day see a problem, ask a question for which there is no immediate answer, and then based on that motivation, begin to pursue an investigation, a line of research that will ultimately, sometimes in the short term, sometimes in the longer term, begin to answer that question and then give us the tools to then help the next patient, or sometimes even the same patient who has that particular problem. I can tell you that for sure, there is no way for individuals like myself or any of my colleagues elsewhere in the field at other institutions that can do any of this without the support of our patients and the support of organizations such as yours, the CHD Coalition. The CHD Coalition has been around since 2007, 2008, and I know our particular institution has been able to receive funding and support for many, many different projects. These projects form the seed for our planting ideas and growing further projects that we can then perhaps recruit additional support for from other organizations to answer broader questions. Let me give you some examples of some of the things that the CHD Coalition has supported. And this is work that I've directly benefited from, that has helped me and my colleagues answer important questions. Back in 2011, there was some seed support for developing our single ventricle survivorship program very early in its initiation days. And that funding was able to allow us to develop a database to better characterize our patients with a Fontan circulation. And this has resulted in multiple publications looking at organ systems such as the liver, such as the kidney, and now more recently looking at exercise capacity as a measure of functional outcome and associating various aspects of organ function with exercise capacity and exploring the relationship between different parts of the body in the uniqueness of a Fontan circulation and exercise capacity. And this is work that's going to be published very soon. In addition, we have been the beneficiaries of the CHD Coalition's ability to support projects looking at the very origins of congenital heart disease. So it was actually back in 2018 when I had the opportunity in person to receive the grace of this organization and have the opportunity to meet so many of you directly at your annual dinner event. And that's when we received funding to look at placental function in our fetuses with congenital heart disease. That funding led directly to information and a recent publication identifying differences in placental blood flow in fetuses with congenital heart disease, suggesting that there are origins for some of the complications that we're seeing later on in life that start at the very, very outset and that perhaps are not directly related to the cardiac manifestations of the form of heart disease that we're looking at, but perhaps in association, the placenta may be somewhat abnormal and dysfunctional. And that's an important discovery, and there's a lot of work being done in this realm. Once we can identify some of these abnormalities, then we have the opportunity to begin to modify some of these potential differences. And that's the next line of research that we're going to be taking. Back in the beginning of 2020, January of 2020, gosh, so much has happened since then, but it seems like ages ago, but it was just a short 9 months ago when a group of us here at CHOP were very, very fortunate to receive funding from the CHD Coalition in looking at functional assessment of liver performance after Fontan operation. My colleague Yuli Kim, who's an adult congenital heart specialist, and a superb adult liver specialist over at the University of Pennsylvania, Maruf Hotite, the three of us put a project together to begin to explore the functional differences in liver performance in our young adults, adolescents and young adults with the Fontan circulation. And this work now, as a consequence of this funding, is beginning. We've started to enroll patients. We've gone through our regulatory IRB process. And the study is looking at sophisticated ways of non-invasively measuring how the livers are functioning in our patients who have single ventricle and Fontan circulation. We know from previous work that there are structural abnormalities, but it's hard to draw a line between some of these structural differences and how the liver is performing. And really, that's the essence of what we're interested in, is how is the liver performing in our patients who have a Fontan circulation. This research is going to directly answer that and develop techniques and methods that we can then bring to the clinic that will allow us to serially measure liver performance in our patients with a Fontan circulation. So I am truly regretful that I'm not able to join you this year directly and to speak to so many of you. I know we've met before and we've had the opportunity to discuss and chat on a number of things that relate to advocacy for our patients with congenital heart disease, as well as innovative research projects. I am hopeful that in the near future we will have further opportunities to meet and to chat directly. I so enjoy the opportunity to have advocacy groups ask questions of us and to hear from us what we think is important, because there is no doubt that we only make progress in caring for our kids with heart disease when there is a strong collaboration between families, patients, parents, and healthcare providers and researchers. There has to be a hand-glove relationship there for us to have success in achieving our mutual goals. So once again, I hope you are all staying well, and thank you so much for everything that you do for your kids, for our kids, and for the advancement of care for birth defects of the heart. I hope to see you folks soon. Please stay safe and well. Thanks very much.